Come on, Professor Doctor, let's hear from Mahmut YAİMURDUR. Is cancer a preventable disease? What methods should be applied to prevent cancer? And in the case of breast cancer, what are the screenings? How should they be done? What tests should be used? It is appreciated that there is a gap between the cost of treating a disease and the cost of preventing that disease. Here, it is necessary to approach the issue on the basis of preventive medicine. We can start the subject by emphasizing that breast cancer is an endocrine cancer, that is, a type of cancer that occurs under the influence of the internal secretion glands. What does it mean? If the team is an organ that we can think of as a big sweater, then where is the preventability in this? So, there is a factor related to lifestyle. Secondly, there is a factor related to nutrition. Thirdly, it has three components: being interested in oneself and taking care of oneself. What does lifestyle mean? If we talk about breast cancer, it can generally be considered as a disease that can be caused by a sedentary lifestyle. There is very good research on this subject. It has been shown that cancer is 12 to 15% less common in people who exercise actively for at least 5 to 6 hours a week. So, the role of more physical activity in this regard is indisputable. What does this provide us with, apart from lifestyle? First of all, it is a concept that prevents obesity. Preventing obesity means reducing fat tissue in the body. Why is fatty tissue so relevant to breast cancer? Because it is a tissue where the estrogen hormone can be active, transform and create pressure on the breast. Since it is closely related to adipose tissue, it is also closely related to obesity. Apart from nutrition, we mentioned that nutrition causes cancer in many organs of the body, including digestive system cancers. This is where the concept we call phytotherapy comes to the fore. Rather, it will be necessary to pay attention to the fact that the foods we should consume while eating are the foods that will reduce the endocrine activity in cancer, that is, the activity of the endocrine glands. Another third component of cancer preventability is taking care of oneself. In other words, the feature we call awareness. What awareness means is showing interest in the body. Showing interest in the body is possible if the woman cares about herself. Whether a woman cares about herself is related to the importance of her role in society. How important is her role in society? In other words, the more women in the society can participate in the productive process, the more care they will have for their body. All these are negligence, indifference to the body, avoiding scans, and with that, I wonder if I went for a scan. It will help overcome the fear of what to do if something happens. This means that cancer is a disease that can be prevented if we protect our lifestyle, nutrition, and self-respect.